Hello, everybody, and thanks for joining us on the Community Health Podcast for Furman University. My name is Matt Bowersox, and today I'm joined by Jill Gravley. She's a Furman graduate and a current EMT with Greenville County EMS. Jill, thank you so much for joining us today.
Thank you for having me.
Now, Jill, I understand that you are a recent graduate of the Community Engaged Medicine program at Furman. So we have a few questions for you, just to talk a little bit about your experience as a healthcare provider and about your experience as a student in the program. So could you tell me a little bit about what first got you interested in pursuing healthcare as a field?
Yeah, absolutely. When I was younger, my grandmother was diagnosed with Alzheimer's dementia. So I was kind of interested in basically the prognosis of that and what it was. I kind of was a little bit too young to understand that my grandma was going to forget who I was and it was totally going to change our lives. So I was really interested in not only the disease process of this neurocognitive disease, but all disease pathways and how these detrimental diseases really affect our families and how we go on with our lives and how medicine will continue to evolve to really try to fix these disorders.
So the way I understand it, this really got you interested in mental health as a subject within healthcare. Can you talk about how you have approached mental health in your position as an EMS, as you have gone out to these homes and interacted with these people around the county?
Yeah, absolutely. More often than not, our patient population doesn't have acute critical issues. It's not all life or death situations. Of course, that's a major part of our job, but a lot of the times people don't have the resources to go to a primary care provider or get mental health services. And so we're going into these people's lives like a snapshot of how they live, and it's less than ideal in most cases. So these houses may have air conditioning or might have like a family of 6 just to a bedroom of 1, or financial barriers that cause food insecurity. There's so many issues that really affect everyone's well-being and mental health. And it all kind of combines together to really make people sick. So part of my job as an EMT mostly is to talk to these people and say, okay, well, what's going on today? Is it specifically depression, or is maybe mental health and underlying condition that's really exacerbating your physical condition in this moment? And so being that shoulder to cry on when they need it, or to hold their hand and be that reassurance and their real advocate, is a main part of my job, especially during the coronavirus pandemic, where resources are limited and we're all kind of social isolating and quarantining. So it kind of really adds a whole new level to how people are dealing with their mental health.
Yeah, I understand that it can be kind of shocking. And I think you described to me earlier how it was shocking for you to see some of the circumstances that you're interacting with now in your current role. Can you talk about how you have been introduced to that way of this new way of thinking about population health through the Community Engaged Medicine program? Can you talk a little bit about how that introduced you to this new field?
Yeah, absolutely. So, I mean, we talk a lot about implicit biases, and in our healthcare seminars, we talked about homeless populations, mental health, really kind of getting in the nitty gritty parts of these, more or less vulnerable populations, because they are less able to really overcome those barriers to take care of themselves and really overcome these health barriers. So in the specific gender, race, ethnicity, different disparities that we've talked about in the program, along with mental health and the different things that we have to overcome as Americans in this health, pandemic specifically, we really kind of talked about different ways to be advocates for people, and not only advocates, but allies, and also really going out and trying to do our best work and really try to help people be better by becoming more knowledgeable, not only about biomedical sciences, but also population health and all of the different things that really feed into well-being and how we can really carry that into our medical professions.
Now, I know that you said earlier that for you, it was interesting seeing how you can impact community health and impact mental health, even if it's in a small way. Would you have any advice for maybe just the average person, maybe somebody who's not a medical worker, but somebody who wants to impact their communities for the better as far as healthcare, as far as mental health? What would be your recommendation to the average American citizen who wants to step up in their community and make an impact?
Yeah, I think that it can be as simple as, kind of stepping back and smiling at somebody. I think that sometimes when you're walking in the grocery store, you don't realize that you might be looking at somebody and kind of subconsciously having those implicit biases, and you really don't know what that person's going through. So, really kind of stepping back and realizing that there's a bigger picture here, that sometimes just telling somebody, I hope you have a wonderful day, can totally change their day and even your day because you're helping someone else. So it's more than just, being an advocate if you've had experience with bad mental health. Some people don't quite understand that it's difficult and it's not easy to overcome, especially with the lack of resources that are available. But really being an advocate and just being nice to people and really making sure you're checking in and just being positive as much as you can, especially in times like this where coronavirus has us all stuck up in the house and we can't really go anywhere or talk to anybody, have that physical connection. So it's important to reach out and check on people.
I think a lot of us feel pretty helpless with the coronavirus going on right now. We're all stuck at home, and there's a lot of people that are doing some great things to improve their communities. We got people, my grandmother, for example, has been making face masks for healthcare workers, but not everybody has that skill, the skill of sewing. So a lot of us are wondering, how can we improve community health? How can we do our part to impact the community, our communities, in a positive way? And I think mental health is a particularly important instance where somebody, or where all of us can affect our communities positively.
Kind of looking back into checking in with people more often. We just had a friend pass away last week. So I kind of haven't talked to him recently, and I really wish I would have. So just kind of keeping up with people and just making sure everybody knows that I care about them and that I'm here for them, and just being a good friend as much as I can.
Well, we are so sorry to hear this. And I understand, as I understand it, this had to do with mental health. This was a mental health crisis that happened. Is that correct?
Yeah, so we're not quite wholly sure the severity of the issue at hand, but we did lose him last week. And I think one way for our community as a whole, not even medical health providers, to really kind of help people with their mental health during this time is just to be active. Make sure you're aware and reaching out to those people that you might not have talked to in a couple months. Maybe kind of say, hey, I hope you're doing well, or, it's kind of hard to smile at people when you have your face mask on, but maybe wave, or, really try to reach out to somebody who maybe doesn't have that social support at home or anybody in the local area to kind of help talk to them and kind of be their friend in a time where we all kind of feel cooped up and isolated. So definitely reaching out. I think if I had to change things, I could even do that more often and really let people know how much you care about them. Even if it's someone that you really never talk to, just maybe like their post on Facebook or say, I hope you're having a wonderful day, and just try to be cognizant of everyone else and their situations, because it might not be just as simple as you might think.
Sure. And that's some great advice. And I think I myself want to follow that advice. And there's plenty of ways I can think that I can impact not only the people that next door to me, but also people who I know personally who are having a hard time right now. So that's some great advice. Thank you. My last question for you is going to be for those who are considering a career in healthcare. They have seen all this happening with the coronavirus, and they've seen, they just are inspired like you were to take on maybe some mental health issues or other issues that are important to them in the field of healthcare. What would be your recommendation as far as them perhaps considering enrolling in the community engaged medicine program? What would you say to those folks who are considering that?
Yeah, I would totally recommend it. It's a great program where you become really well-rounded, not only in biomedical sciences, population health, and so many different facets. And you really learn how to be comfortable with being uncomfortable. And it's hard to become vulnerable and tell your story, but you can really become vulnerable and learn not only from yourself, but also your other peers and teachers and your fieldwork experience by really kind of realizing who you are as a person and what you care about, and also kind of seeing what your next steps are. So it's a great program. I highly recommend it to everyone. I learned so much, and I'll take all of it with me in my next steps to becoming a doctor.
Well, Jill, thank you so much for joining us, and thank you all for tuning in to this week's episode. We hope to join you again next week with a new interviewee, a graduate of our program. So thank you so much. We hope you have a great day and stay safe out there. Bye-bye.